Hey guys, welcome back to the channel. What's up? Today I want to talk with you about mommy wrist or DeQuervain's Tenosynovitis. So today we're going to be talking about what the heck that is, what causes it, and what you can start to do about it. So let's go ahead and get into it. Okay, so what the heck is mommy wrist anyway? DeQuervain's Tenosynovitis is a thickening and inflammation of the fibrous sheath, or kind of the tube, that surrounds two of the tendons in the wrist and thumb. Those tendons belong to the muscles extensor pollicis brevis and abductor pollicis longus, and it's going to be affecting the radial side of the wrist right here, kind of near the base of the thumb. Let's look at a picture so that it makes a little bit more sense.
Okay, so looking at a picture from the Netter's Atlas, we've got the thumb right here. See, right here is where the extensor pollicis brevis starts. That's where it's turning into muscle. And then the abductor pollicis longus is starting right here in the thumb and wrapping around. Looking at another picture from the Netter's Atlas, you can see that these two thumb tendons right here are passing underneath this little tunnel. It's labeled number 1 here, but you can see it's part of the extensor retinaculum. We actually call that the first dorsal compartment of the wrist, and that tunnel holds those two tendons down to the bone. And what starts to happen with DeQuervain's tenosynovitis, or mommy wrist, is that those two little tendons start to get inflamed. They get thicker, like the sheath that surrounds them gets thicker, and so you can tell there's just not much room in that tunnel, and so any extra inflammation or any extra thick tissue is going to cause impingement, irritation, and pain right through that area of the tunnel.
DeQuervain's tenosynovitis is also called mommy wrist because it's very common in women who are pregnant or have just had their babies. There's a likelihood that it comes from several factors. With pregnancy, there's going to be a lot of hormonal changes in the body, a little bit more inflammation. That's going to put you a little bit more at risk for a tendinitis or a tendinopathy to develop. Oftentimes, too, after new moms have their baby, they're like lifting their baby a whole lot. They kind of scoop him up under the arms. When they're nursing, they tend to have kind of hyperflexed wrist position and that static position of pinching, gripping. Hyperflexion of the wrist can cause irritation of those two thumb tendons there in the wrist. But there's also other factors, so it's not just something that occurs in new mothers or pregnant women. It is a little bit more likely in middle-aged women, people with autoimmune or inflammatory conditions such as rheumatoid arthritis, gout, diabetes. Those things can increase your likelihood. But the most important factor is truly use, and repetitive use especially. So, people who are pinching and lifting things, they're doing a lot of rotational movements, twisting kind of movements. Anybody who's kind of lifting and allowing their thumb to pinch down while the wrist is deviated as well, those people are going to be a little bit more likely to develop DeQuervain's tenosynovitis. So what do you do if you think that you might have DeQuervain's tenosynovitis? First things first, you should head to your doctor, preferably a hand specialist if you can, and they can help guide you to the right form of treatment for you, whether that be therapy, splinting or orthotics, cortisone injections, or even surgery. Typically, hand therapy or non-operative treatment for DeQuervain's or mommy wrist is going to include some sort of splinting or bracing, typically with a thumb spica splint. You want a thumb spica that covers both the thumb you can leave the tip of the thumb free, but starting at that MP of the thumb, right, coming down into the wrist and into the forearm to help stabilize the wrist and the thumb from too much repetitive use. Typically, I recommend my patients wear that during the nighttime to avoid kind of those awkward sleeping postures, but also during active hours of the day to prevent repetitive use and help to stabilize the thumb, especially in the first few weeks. basically we want the injured tendons and the aggravated area to get some rest. Let them rest, let them heal. Try to avoid aggravating activities, things such as pinching, especially with the wrist position, right, that's tilted or deviated. Try to avoid heavy lifting activities. Always lift from underneath rather than picking up this way. Try to avoid overuse of the thumb and overuse of the wrist. If the pain has been going on for less than 3 months, try to get into a routine of icing your wrist, plopping that ice bag right on top, giving it about 10 minutes at a time. That will help calm down some of that acute initial inflammation in that area. And of course, always make sure that you're stretching frequently. Every 2 hours, you should be taking at least a 30-second stretch break. More frequently if possible, right? I typically recommend starting with some forearm stretches where you're just gently kind of trying to bend that wrist down, pull it back, and hold. Make sure they're nice, slow stretches and you really feel a gentle stretch, not too aggressive to the point where you feel pain. Okay, so that is a basic quick and dirty rundown of mommy wrist or DeQuervain's Tenosynovitis. I hope you guys enjoyed this video. Thank you so much for watching. Please subscribe to the channel for more hand therapy content, and I'll see you next time. Thanks.